Welcome to the Smart Tips for Stroke Care series. This topic of Smart Tips covers an introduction to stroke. Smart Tips for Stroke Care is a guide that explores 15 different topics related to stroke. It highlights common changes due to stroke and strategies for managing these changes. You can find the complete guide on the Core Health Ontario website and the educational videos on the Central East Stroke Network website. It is important to be aware that stroke ranks as the third leading cause of death and is a leading cause of disability in Canada. 60% of persons who experience a stroke will have a long-term impairment that can affect their participation in everyday activities. 1 in 5 persons living in long-term care facilities has experienced a stroke. Recovery from a stroke can be an ongoing process throughout one's life. Knowing how the brain works can help understand the outcomes after a stroke. The brain is divided into 2 halves called hemispheres. The left hemisphere controls the right side of your body, while the right hemisphere controls the left side. The location in the brain the stroke occurs determines what functions are affected. A stroke is a sudden event and occurs when the blood supply to part of your brain is interrupted. This causes brain cells in that area of the brain to die. The effects of a stroke depend on the part of the brain that was damaged and the amount of damage that was done. There are 2 common types of stroke. The most common type of stroke is called an ischemic stroke. This happens when blood supply in the brain is blocked by blood clots and/or buildup of plaque in the blood vessels. Ischemic strokes account for more than 75% of all strokes. Another type is a hemorrhagic stroke. This occurs when a blood vessel in the brain leaks or ruptures. Hemorrhagic strokes account for less than 25% of all strokes. It is also helpful to understand what a TIA is. TIA stands for transient ischemic attack. These can sometimes be referred to as a mini-stroke and are caused by a short-term lack of blood flow to the brain. TIAs may cause stroke symptoms that last minutes to hours. They are considered an important warning sign that a more serious stroke may occur soon. TIAs must be treated as a medical emergency and 911 should be called immediately. It is very important to know the signs and symptoms of stroke so you can recognize it and act quickly. The acronym FAST is a good way to remember the signs of stroke. F stands for face. Is it drooping? A stands for arms. Can the person raise both arms or does one drift downward? S stands for speech. Is it slurred or jumbled? T time is critical. Call 911 right away. There are some other signs of stroke that may occur as well if there is a sudden onset. These include a loss of balance or coordination, changes in vision, a sudden and severe headache, and numbness in one half of the body. It is important to remember, if you suspect a stroke, call 911 immediately. Time is critical to receive early interventions. Some early interventions for people with ischemic strokes are clot-busting medications called thrombolysis. This drug aims to dissolve the clot and return the blood supply to the brain. Thrombolysis must be given quickly after the onset of stroke symptoms for eligible people. This can only be given up to 4.5 hours. Examples of clot-busting drugs are called TNK or TPA and are given at specific hospitals in the region. This is another reason why it is important to call 911 to be brought to the closest hospital that provides this level of stroke care if required. Another early intervention for eligible ischemic strokes is thrombectomy. Endovascular therapy, or EVT, involves the mechanical removal of a blood clot within a large artery of the brain. This procedure can be performed up to 24 hours after the onset of symptoms in select patients. Here are some main parts of the brain: the frontal, parietal, temporal, and occipital lobes, along with the cerebellum and brainstem. Each part is important for how our body and mind work. The frontal lobe is responsible for memory, planning, thinking, organizing, emotions, and controlling movement. The parietal lobe deals with sensory processing like taste, pain, touch, and temperature. It is also responsible for body awareness, language, and spatial awareness. The temporal lobe is key for memory, understanding words, emotions, visual recognition, and senses, especially sight and sound. The occipital lobe helps us judge distance and depth perception, recognize objects and faces along with memory formation and color. The cerebellum is responsible for balance, movement, and coordination. And the brainstem controls many vital functions of the body, including heart rate, blood pressure, sleep breathing, and reflexes. A stroke in any of these areas can affect these functions, causing problems based on which lobe is affected. Every stroke is different. Depending on what part of the brain is damaged by the stroke, the person may experience physical, cognitive, perceptual, and emotional changes, which may include one-sided weakness or paralysis, loss of balance or coordination, bladder and/or bowel problems, difficulties with swallowing, fatigue, and trouble communicating. Some more common effects include a loss of sensation, which includes how you perceive touch, temperature, etc., difficulty paying attention to one side of the body or environment, changes to vision, changes in thinking and/or memory, changes in personality or behavior, and changes in emotions or mood, such as unexpected emotional responses. What increases someone's risk for a stroke? The next 3 slides will talk about different risk factors for stroke. Here are listed the non-modifiable risk factors, which unfortunately we do not have control over. These include age. There is an increased risk when you are over the age of 55. Gender. After women reach menopause, they have a higher risk than men. Genetic factors. There is an increased risk if a parent or sibling had a stroke before the age of 65. Ethnicity. Increased risk for individuals of African, South Asian, and Indigenous heritage. And lastly, individuals who have had a prior stroke or TIA. Here is a list of risk factors related to lifestyle factors which are modifiable. These risk factors include an unhealthy diet, smoking, obesity, sedentary lifestyle, excess alcohol intake, recreational drug use, and poorly managed stress. Other risk factors related to disease and medications include high blood pressure, diabetes, high cholesterol, heart disease and arrhythmias, coagulation disorders, vascular disease, sleep apnea, and taking birth control or hormone replacement therapy. Understanding the effects of stroke will help you to provide better care and support to the person with stroke and their family. It is important to remember that recovery is possible after a stroke. For more information on smart tips, including other topics related to stroke, visit the Core Health Ontario website.